everyone. Welcome to the wisdom series of Alchemy of Being by Nirali Shah. I'm your host, Xanthanil, a story changer. And today we are changing the story of the people who are extremely afraid of something or the other. For example, I know somebody who's extremely afraid of lizards. The moment they see a lizard, they'll kind of scream and get into an extreme panic where, they'll just keep on jumping around until the lizard is kind of shooed away from their sight. And until the lizard is out of the room, they won't sit at peace. So let's ask Nirali. She is a life mentor, she's a healer, she's a therapist, and she has been working with people with various ages since 18 years. And let us see what she has to say, how she explains phobia, and how does she handle and help people who come to her with the phobia of things. Let's welcome Nirali. Hi, Nirali.
Hey everyone, we're back again.
Yes, exactly. I want you to explain our viewers what exactly is phobia and how do you explain phobia.
Right. So, phobia is basically an anxiety disorder. That's what we would put it up in the psychological terminology. It is a persistent and extensive or excessive fear of an object or a situation.
Okay.
Right. So, when would we call that something is tagged as phobia? When a fear of something a object or a situation exists for more than 6 months, when a person comes in contact with a similar object or a situation, if it persists for more than 6 months, that's when you can actually start observing it as whether it is converting into a phobia. Now how does phobia occur? Let's get to that part, because that would kind of give us a broader idea on understanding the difference between what is a normal fear
Hmm.
and what is phobia.
Okay.
Yeah. So if you were hurt a few days back because of a knife, yeah, you bled a little, and next time, when you pick up the knife, you're going to be aware that I want to be careful next time if when I use the knife.
Right.
Now that's called a little, you could say, fear that is bringing awareness to your body, that I need to be aware, I need to save myself. That's where the brain gets activated. Now the the phobia, how do we define phobia? And a very simple example, that the same story of being hurt with a knife and bleeding. But if it is converting into phobia, the behavior towards reacting to the knife is very irrational. And people might just feel that it's just knife. You've seen this for your entire life. What has happened to you suddenly? Why you're reacting? Why you're feeling angry? Why you want to run away from it? Why you don't want to look at it? People around who observe person who's reacting abnormally to a very absurd thing, wherein the next moment the person is completely fine, the moment it's looking he or she is looking at knife, the behavior changes. So this is where the term phobia comes in, because that's where the entire bodily system and mind gets into very uh, irrational mode. The person's logical mind, uh, the behavioral pattern that kind of keeps person to fit into the society. All of those logical systems kind of shut down in the moment, and person reacts rather in a very abnormal way, trying to run away from it, trying to be extremely scared of it, with as if this little small thing is going to eat up,
Right.
it's going to kill them, or it's going to hurt them to the extended level. So this is where the phobia, comes in. The word phobia comes in. Now, where does phobia exist? Let's also understand this, because we usually believe that phobia exists in the mind.
Mm.
I would rather say that phobia exists in the subconscious. It's a deeper level. If it was just mind, then it would be the earlier symptom where you're just becoming aware. Your body
Right.
becomes aware, your brain becomes aware that I need to be careful. Here it is deep rooted out
Okay.
of some traumatic incident that is connected with that object or that situation, some traumatic experience, emotional experience that is connected to that object or an incident, that brings in that fear
Right.
to an extensive level. So it comes from the subconscious, and it's kind of attached to, it could be attached to anything. You know, there are various types of phobias in the world that exist. So let me name a few. Agoraphobia, claustrophobia, phobia to an insect, as you just mentioned in the beginning of the
Yeah.
conversation, uh, object related phobias, um, phobias related to water, heights, phobias related to a certain color. Like, let me give an example which kind of makes it more relatable. If anybody has watched Kung Fu Panda, the second part of it, once Po, kind of becomes a dragon warrior, and he's the mighty warrior who's saving the villages from the, claws of the evil,
Mm-hmm.
people. Now, one of his wars with evil people, he come across a very specific color and a symbol, which kind of, where he loses himself completely.
Mm.
He loses all his strength, he loses all his power, even the idea that he's a dragon warrior for that specific moment.
Right.
And he doesn't have any logical explanation in why he's reacting to this symbol in a certain manner.
Yes. Yes.
And until he becomes in line with his past, accepts it, and finds peace with it, he's constantly in war within himself, in conflict within himself, even somewhere doubting his own warrior qualities.
Yes.
So this is exactly the position of a person who's under the phobia
Okay.
of XYZ things. And the person, however smart, intelligent, powerful, confident they may be in rest part of the world, rest part of the life, a small, situation where they're in the enclosed places, or they are. They come across a certain kind of an insect, nobody else but that specific insect, or they're okay with all sort of water, but if they are they meet with an ocean,
Mm.
that's where that specific emotional experience or the trauma replays for them, and they
Right.
suddenly feel so small, and the entire object feels overwhelming, large, and extremely scary for them. So yeah, this is the very easy to understand definition to phobia.
Phobia. It's so good to have terms like phobia so simplified, because I have usually seen people use the word phobia so casually, and the people who actually have some phobia, they are the ones in extreme confusion about how to handle the situations. So when I talk about these people who are actually going through a phobia, how do, for example, I had a phobia of something. How do I myself identify that this is a phobia for me. What are the points that I need to be aware of about myself, so that I can be aware that this is a phobia and I need some help with regards to this particular fear.
Right. So, since I've already used the Poe example, I'm going to continue using that throughout the
It is a very
conversation.
cute example that you've used.
Right. So, I'm going to ask you the question. If you remember the story, what was Poe's reaction when he first sees the symbol,
Uh,
that
I
red mark? And
I don't remember the entire movie that well, but I do remember that he was extremely afraid of that particular symbol, and he was having he was recalling some memories which were related to that particular symbol, but he was not able to relate to those memories. So he was in a complete confusion about what exactly is happening to him. And specifically because he was a dragon warrior as such, he was even more confused that being such a brave person, how can a symbol like this put me in so much of fear and anxiety, and not knowing what is happening to me.
correct. Now, that is what you've explained is the inner world of Poe. But what
Yes,
were the outer symptoms? That's what we're trying to identify.
how the
So,
symptoms.
when you're saying anxiety, what are the symptoms of anxiety?
uh, from what I remember, he used there's a lot of speed involved in your activities. Speed in the sense, not like let me just finish it fast, but it's like you want to get out of it. You kind of start
Yes.
hurrying things up because you want to get out of it, to feel
So,
relieved, to feel the
yeah,
main reason to
yes,
hurry up is
running
to feel
away
relieved.
from that scene, that
Yes,
situation. Yeah.
yes, yes.
So, this is actually uh, an accelerated fight or flight mode. The phobia, since it is
Right,
a anxiety disorder and accelerated anxiety disorder, it is an accelerated fight and flight mode when all the things, when a person who's in a normally fight and flight mode, all the symptoms kind of happen in a multiplied speed. So it could
right.
start with freezing on the moment,
Hmm.
not knowing what to do,
Right.
right in front of that situation, whatever that thing is. Uh, that could be chest pain, heavy sweating, abnormal breathing. Suddenly you can actually hear the pumping of the heart. If you're close to
Yes,
that person, you can actually hear the heartbeat. It could
yes,
it could get that worse. People around sometimes also find it very difficult to handle a scene like this because they don't know what to do. When suddenly a person was laughing and the behavior changes.
right. Yes,
uh, the hot and cold flushes within the body. uh, Sometimes a person feels choking sensation, dryness of mouth, there is confusion, disorientation. They totally forget where they are and what they were doing before. So that happens. There is dizziness. There could be severe headache experienced right in the moment, or even it kind of continues later after the episode is over. So these are some common signs and symptoms that we could see when the person is under the episode of phobia.
right. So these are some physical symptoms that people can be aware of. That if they are going through these symptoms again, not once or twice, but for an extended period of over 6 months, that is when you come
Coming across the same object or a situation again and again.
for over a period of 6 months. So it's not like if it has happened once or twice, I don't need to get into a panic of I've got a phobia of something. It's just when the same reaction comes over and over again for the same particular situation.
Yes.
Right. So, as adults, we are able to handle these fear situations very differently. But when it comes to children, I have often seen that children find something wherein they're very afraid of it, and the parents just go around saying, "Oh, you have got to be brave. You have to learn to handle situations, and don't be such a baby." And the other children start laughing at the child. and the child feels extremely unsure about what is happening to them, and it is a, I've seen on their face, it's a very sad situation for them. So
Right.
how do you as a healer address these kind of events?
So, just to bring it to more awareness of parents, see if it is a now see as we've already discussed earlier, what is called phobia, what is termed as phobia in terms of even understanding the signs of it. First thing is, as a parent, is to be aware whether my child is complaining of a certain fear as it is something that needs attention, or it is just a normal thing that he's picked up from surrounding or somewhere. We also have a habit of scaring away the child that if you don't do this, something like this will happen. So is
True.
it that, or is it some severe serious situation that he's complaining of? Now now since we're talking about it, I would also like to mention that somewhere when the child comes to you with a real situation, a real problem, and that to be an emotional problem that he's going through and is looking for solution. See, what happens is that most times, by telling them that brave up and don't be a baby, with things like this, we somewhere you know we close the child to his own emotion.
Yes.
This is a place where child and as a parent we need to understand what emotion that needs to be acknowledged at this moment. We don't need to pamper them in this moment. We definitely are here as parents to give them strength and courage to deal with life situations, because as parents we are here right now, but there will be a situation where the child will have to deal with it all by himself for now, in school, in tuitions, as a teenager, as a young person. It's possible. So we're not going to be there through and through saving him. The the best thing as parents we can do is, first and foremost, is to make child be aware of his own emotion, and acknowledge it, instead of closing him down to that you're not brave enough, or because that's the kind of information we are giving, that if child is opening up to emotion, he is somewhere understanding that I am showing my weakness to the world, to my parents, and I shouldn't be doing that. Emotions are not weaknesses, they are weaknesses when you don't know how to handle it. And I think that is one of the biggest uh, you know uh, system default that we I would say that we are programming children towards. So let's not close them down, and let's also not close ourselves down to their emotion. Let us identify by asking them question whether it is a fear or whether it is a phobia. And if it is a phobia, if at all it is a phobia, then it's a severe matter, serious matter. It must be looked at very, very importantly and urgent. This is a place, if it is not, and I've worked with various cases where in the young age, when the phobia is not treated, a lot of additions of traumatic events take place in child's life because of that phobia, and that somewhere also possibly leads child to having depression.
Right.
So if we really want to do that, let's address a simple thing such as phobia. In the childhood, it's very easy and possible to be treated in a younger age if we are catching in the right age. Yeah.
Right.
Now let's understand, if we are seeing a phobia in child, how it might be coming to them. In general case, as an adult, the phobia can arise surely coming from the childhood, uh, or a recent event. Like in post case, it was a child situation that was occurring in a younger age. For many adults, if they have met with an accident, or long back when there were young people who had witnessed earthquake,
Yes.
where the people who were just their family members, and they were standing opposite to them, and suddenly they've seen them dying in front of their own eyes. All those places. Now these are the traumas that could get converted into deep rooted fears, and that could get converted into nightmares. And if not treated or right in that moment, then there is a chance for it to get converted into phobia. So uh, this is a place where the child, I mean the young person might feel if there is a little bit of disturbance, or uh, what do you call it, movement.
Mm.
The person has the immediate recall of the earthquake, or with that they'll suddenly get emotional, because even if they logically they are aware that they've lost family members in that moment, that simple uh, shake of shaking up a house, or anything. It could also be a tree shaking
Yes.
badly because of
Mm.
what is it,
The wind.
Mm, the wind, or the storm. The
Mm.
word I was trying to get to was storm.
Mm.
So if even with the storm, they get scared, they feel that things are going to fall on them.
I'd like to share that the earthquake that happened was in 2001. Until date, so many times, my husband literally kind of wakes up in the middle of the night and saying, "Get up, get up, get up! There's an earthquake! There's an earthquake!" And I'm like, "There's nothing. Just calm down and just kind of go to sleep." So yes, I can kind of
Yeah,
relate to
yeah.
that
So
example
that's
that you're giving.
yeah, yeah. So that's exactly. And see, as far as something is not disturbing uh, the routine life, some event is not disturbing the routine life, it's okay if it gets untreated. But if it is already disturbing the way you're living, the way you're performing, I think this is the place where you actually need to pay attention to, and focus on that part of you, because it's part of you. That experience is part of you.
True.
Why uh, you know create it as a somebody else's thing. It is never going to happen. It will remain part of you, and only the more you ignore it, the more it is going to give you trouble. So it needs attention. uh, Coming back to the part of being dealing with children, if they have a complaint towards a fear and phobia, many times it is something that they've seen as a child, as a in their surrounding. So as I said, earthquake is an example. Poe is another example of what he experienced as a baby. Now, see, sometimes we
True.
feel that a 4-year-old, a 5-year-old may have an experience. No, even a baby. Something, even if something happened to a mother in the womb, the child can carry the trauma. So there is a possibility that it can be carried in the childhood as an emotional experience, uh, from the womb, as a baby, as a child, as a toddler. With all of that, there are some experiences that children are also carrying from the previous life. And this is a fact, it's a scientific fact, it's proven. There are a number of books written on that, and so many ways people have been treated also for the past life situations that has been occurring and creating uh, this harmony in the present life. So I like to mention this book again and again. It's one of my favorite book that that talks about how past life trauma and emotions can be treated through healing. And in that, he talks about a character called Catherine, who's a real life character who came to him, and how he treated him, treated her for some experiences that were coming from many previous lives, and that had been transmuted in the present life as phobias, as severe fears, as anxieties, as insomnia, and a lot of physical diseases which was not getting cured with any medication, any psychiatric treatment, any psychiatric medication also, not neither with any physical surgeries.
Right.
So it's a wonderful book that kind of gives idea on what a phobia of a past life can create in the present moment. So that could also be a thing. So sometimes people or a parent also feel it's so illogical for a child to experience the fear for water or fear for height. I know. I mean, you know, he's just been in this world. How why would you have fear for something like this? But yeah, that can happen. And I want to say that if you're aware and if you're ready to resolve it, there are ways that are beautiful and that can actually help you to resolve that situation of life, and you find that peace within the entire experience of Poe. How he finds um, his strength back just because of that little life experience.
Yes.
He was uh, stuck at being himself,
Hmm.
the dragon warrior that he was, the funny guy that he was. He used to fall into that shell, and
Yes.
he used to lose wars because of that. That's exactly what happens with us, when we are actually going through a small situation of facing experiencing phobia, where the way he resolves it by getting in peace with himself, with that part of him. See, the idea is to get peace with that part of him. That kind of brings him to be even better than what he was. He kind of excels him from what
Yes. Yes.
he was. In fact, he excels as teacher. After he finds peace within, he was able to create even better for himself, and help the world with a lot of things. The point is that it's coming in peace with that part of you. That is what is important. So I kind of not only explained the fear of the fear part, the phobia part, the things with childhood. One more thing that I would like to, I'm going the flow, so I think I'm just going to go in the flow.
Yes.
One more part that I would want to share is that if parents don't look at the phobia right at the early age, what happens is that sometimes children get bullied
Yes.
in the when they're in a school environment, when they come across a situation like this. Example, they are being locked into a closed place, out of fun, and then they start behaving abnormal, and people start calling them mad and weirdo and all of that. They already have a traumatic experience within their subconscious, which they're trying to deal with, and they don't have the answer for it. Now, in addition to that, they're also the social outcast, because now people are
Yes.
considering them as something, you know, uh, in a very, antisocial kind of a phenomena. So, we are basically, as a parent, if you're ignoring these situations, we are also adding more traumas in their life. And somewhere, because we've already shut them down by brave, be don't be a baby, and uh, be the brave boy, and don't cry, and is this something to be scared of, whatever. They already closed them down. Now with this, they're never going to come back and talk to you about the same fear that they're actually experiencing in life. And this experience of not coming and telling you the fears of their life will continue even when they grow up. So in a real situation, when they feel scared, where would they lean towards? Where would they lean towards? They usually lean towards friends who might give them emotional support. If they are good friends, it's
True.
a blessing.
Blessing,
But
yes.
if by any chance the friend circle is misdirecting, uh, they could go towards more drugs and alcohol, and they'll find solace there.
Yes.
So instead of actually curing ourselves and finding peace and becoming more, we're damaging not only ourselves, our family, our child's life, child's future. It is also giving them an open space to, uh,
Create more damage.
allowing him to get into a wrong place altogether.
Yes.
See,
Yes.
there are endless possibilities this way and that way. What we
True.
choose in the moment, you know,
True.
as a parent, till they, begin to take decisions by themselves. This is the kind of support that they require at this moment.
Like,
So,
so,
is there anything?
since we've understood the concept, the idea, the reality of phobia and what the people go through themselves in terms of phobia. So, what is it that can actually help them get rid of this particular reaction to these events that they are very scared of? How can they overcome these emotions and these symptoms that they go through?
Right. So, I would start with how it is usually treated in terms of psychology, in terms of therapies. Uh, so medication is obviously one of the ways, if things are so severe. Uh, the other way is counseling and therapy, where
Okay.
the person is made to re-experience the same, traumatic event again and again with right support and encouragement. So there is a way where the person is taken through that experience, or the child is taken through that experience again and again, or talked about it. Ask the child to, or the adult to recall that event again and again, and then put logic in it, because there is no logic somewhere. We try to treat it with logic, and then there is another way where we go to the subconscious without having to actually converse about this painful memory, and you delete that file. It's like going into the computer's hard drive where unwanted and wanted data is stored. We kind of pick up the unwanted data and we put a delete button. We press a delete button. It's out of your system. It's out of your recycle bin, and you're good to go.
That is such a simple and so accurate explanation of how it can actually be resolved, and how it can
Addressed.
actually be made to make your life more easier and more
Yes.
peaceful. Yes, amazing.
Yeah.
So phobia basically is something that makes you respond to a situation with extreme emotions repeatedly, again and again and again and again. And it is best to have these phobias identified as early as possible. Most in most cases, it is usually since the childhood. And the treatment for phobia can be as simple as just delete and clear. That's amazing. The
Yeah.
delete and clear. I love
if
that.
if if you're looking for easier way, yes.
Yes, I love the delete and clear.
Right. With
So
all of that, uh, yeah, with all of that, I would also add, and if you have any question on that, when you are an understanding, empathetic caretaker, parent, or a friend, yeah, how you're going to deal with a person who's going through the phobia symptoms right now. Okay? So let's just take a quick look at how we can be a help in that moment. So first and foremost is that since they are going through this. accelerated heartbeat and having difficulty breathing, the one thing which we can do is that you can just comfort them and ask them to take deep breaths. That would really soothe them out. Just keep telling them to deep breaths. That would kind of help. Second thing is try to distract them from that specific object or a situation, so that they're not focused there. So with a conversation, with dragging their attention to something better, that would really help. The third thing could be bringing the laughter from
Right.
somewhere,
Laughter is
a
the best
joke.
medicine, I believe.
Yes, and in a place like this, it is like, it's like a, Tinkerbell's, or what do you call it, those magic powder,
Magic. Yes.
you know.
Pixie dust.
So pixie dust, that's
Pixie
the
dust.
word. Correct. So just sprinkle some pixie dust called laughter, if possible, if you know how to get there. Don't panic yourself that, oh my god, what happened to this person. Don't start crying with them,
Right.
because you need to have yourself in a more stable mind and in the moment. And obviously, once this is sorted, once this is treated, um, it is a good time to actually get help, whatever treatment, whatever delete button that you can offer to these people related to the specific phobia, so that they can live a happy, healthy, and more fulfilling life.
Okay, that was a great wisdom for this change of story. And let's meet our viewers in a new episode very soon.
Yeah. So before we end, I'd like to add one beautiful quote. That is, fear has two meanings: forget everything and run, or face everything and rise. We always have choice.
Rise. I love the word rise. Face everything and rise.
So see you guys in the
See
next
you guys.
episode with a different topic for wisdom.